Hey guys, so today's conversation is around why is it that we do addiction medicine in the first place? A lot of people ask me that question. I've got a lot of colleagues that ask me why we do it. My background is that I began in family medicine 20 years ago as a family doc. Quickly realized that a lot of my passion really lies in mental health. Began getting patients that suffered from depression, anxiety, bipolar disorder. Realized that that was really my passion, something that I enjoyed doing. Began delving into it more and more and sort of subspecialized in it. I began getting other patients with addictions as well, because sometimes mental health and addiction go together. In fact, almost always. And I realized in medical school they don't teach you anything about mental health for the most part, and definitely nothing about addiction, and definitely nothing about pain management. A lot of you people have been made addicted to medications by physicians, by doctors, people like myself, that although sometimes are well-intentioned in terms of trying to get you help for your pain management, inadvertently get you addicted to these opioids. In case you're wondering where I am, this is Florence, Italy. Beautiful area. So the addiction starts from doctors. The word is iatrogenic. That means doctor-induced. It's not a good thing, but that's how it starts. And then you become tolerant to this stuff. You become dependent first, and then you become tolerant to it. Tolerance just means it takes more and more and more to get the same effect. You used to get pain relief with 1 or 2 Vicodin. Now it takes 3 or 4. Now the Vicodin's not working anymore. Now it takes Percocet. Now the Oxy isn't working anymore. Now it takes OxyContin or Dilaudid. It never stops. The tolerance builds up. That's one of the problems, is that we don't have any knowledge about how to stop the tolerance. For the most part, it just keeps going and going and going until you die, of course. And that's where 50,000 people die, when they don't realize that their tolerance level is just not what it used to be anymore. And it doesn't take much. It doesn't take much. Dying from opioids is usually, it's not just the opioids, it's usually opioids, painkillers mixed with stuff. You might wonder what stuff that is. It's almost always Xanax. Either rate, it's always a benzo, but Xanax is the most common one, and that's why I'm a big fan of trying to eliminate Xanax as much as possible. A lot of meds work together to kill people. It's kind of like alcohol is another classic drug that we use together with the opioids, and people don't think about it. They're like, well, I'm just going to have a beer or two, as usual, with their normal amounts of painkillers, and then one day they don't wake up. There's no warning. You don't know. You don't feel like you're going to die someday. You just have no warning. You just die. And that's the problem. So I quickly discovered that there's no training in this area at all, and that became sort of my passion and my mission, is to get some of these folks like you guys from insane amounts of opioids off. What I hear from a lot of my patients is that you guys have a lot of true, legitimate pain reasons to need opioids, which I understand. Those are legitimate pain conditions and they have to be treated. We just have to treat them properly. We have to look at the whole person. I have to get those people who are on 3 to 4 to 500 milligrams of oxycodone off. You can't keep taking that stuff. You will die. You guys have families and children. You can't live that way. It destroys your lives. You can't find it from doctors anymore. You start getting it from the street or from friends. It's just a downward spiral. So a lot of folks have come to me and we've said, let's acknowledge, first of all, that you do have chronic pain issues. Those are real. Those are there. Let's address it. Let's address it conscientiously and diligently. I know sometimes you've tried other things for pain management that haven't worked, but sometimes it's not that people try the wrong med or that meds don't work. Sometimes they just don't get the right combination of medications, It's like very much like cooking, where it's not that a novice cook fails just because the spice didn't work out. Generally what happens is they got the wrong combination of spices, the wrong recipe, if you will, you know. If a proper chef had done it, it probably would have worked out just fine. Instead, we're overdosing on salt and oregano, if you will. There's a lot of tools out there. My commitment and my promise to people is always, it doesn't matter what it takes. We need to get the job done, and it will require the appropriate amount of work to do that. People ask me how we're going to accomplish the job and get rid of the opioids without leaving them in utter pain. Number one, understand we're not judgmental about your condition. We're not judging you for getting down that road, needing those 500 milligrams of oxy or whatever it is. But my wish for you is maybe we can find something that works better for you. Maybe we can find something that will provide you the pain management that you deserve. And maybe there's other things that we can address as well. A lot of people have other stuff, depression, anxiety, stress in life that makes the pain management 10 times worse. And it's really important that we address those as well at the same time. So gradually and slowly, we kind of start wherever a person wants to start. My policy is always meet the patient where they're at. Wherever you're at, that's where we'll start. If you say, hey, I'm not ready to come off of this yet, but I'm just ready to have a conversation and at least discuss it and figure out if there are options and what your options are. A lot of those options are very poorly understood because there's a lot of misinformation on the internet, a lot of misinformation from friends. Sometimes friends have gone through treatments that didn't work out well, and that's always a problem. It flavors your own experience. But let me just ask you and beg you to not brush everything off just because a friend or a relative had a bad experience with something. Again, it's just like cooking. Just because I mess up a recipe terribly trying to do it on my own doesn't mean a proper chef couldn't come in and get the job done well. I'll just close today by saying, welcome over, give us a call, get in, let's have a conversation. If it doesn't work, it doesn't work. But what if it does work? What if we find something that works? What if we have to run at it 2 or 3 times and we finally get something that works, something that prevents you from dying just because of the opiates that we physicians have gotten you hooked on? That's my commitment to you, is to get the job done, get you off those opioids, find proper pain management for you, and then treatment for anything else like depression, anxiety, with whatever tools work for you. My job is to go through the tools, go through the options for you, and your job is to see if all this makes sense. And if it does make sense, then and only then we move forward, okay? Have a good night, guys. Bye.